All right, we have an exciting lineup of speakers from all over the world, some of whom may be jet-lagged, so please be nice to them. But anyways, my dear colleague, Dr. Matthew Collin, who is world-renowned scientist and physician in the myeloid field, he's going to be talking about manifestations of histiocytosis in adults. We'll welcome Dr. Collin.
Great. Well, thank you so much for the invitation. It's always a great pleasure to speak to the patient and family group. And so the remit today is to talk about manifestations of histiocytosis. So I thought if we start by asking one of the most famous doctors to summarize, and not quite as famous as Eli Diamond and Julian and maybe Gaurav, but he would say it's blood cancer, but not as we know it. So in the next 10 minutes, I'll unpack some of those ideas with you. Oh, okay, great. So we're going to talk roughly about the different types of adult histiocytic neoplasms and some similarities and some differences, and what makes us believe that they're all related, essentially. So I thought one way to do this would be to go through a couple of questions that patients often ask me. So why is it called histiocytosis? Is it cancer? How long have I had it? Why does it do the things that it has done to my body? And then particularly, is it going to be a serious problem? Is it going to shorten my life? And often, is there anything that I should do or should not do? So why is it called histiocytosis? It's a kind of quaint term, but it comes from the fact that the immune system doesn't only live in the blood. So the doctor will often sample the blood, but most of the immune cells in your body live in the tissues, in the lymph glands or the bone marrow, and in fact, almost all of the organs. And one of the major components of the immune cells that live in the tissues are cells called macrophages. And the macrophage and also the dendritic cell are modern names for this quaint word histiocyte, which means literally tissue cells. And straight away, I think that gives you a clue as to why these diseases are quite weird and wonderful, because they're giving you bone marrow failure, they're not giving you leukemia, they're doing weird things to multiple organs in the body, and that's because they affect these tissue cells, these histiocytes, that live in almost all your tissues. So I just show you a picture of what these guys look like, and this is taken from a normal piece of skin, and it's actually a blood vessel. And what you can see here are the green guys are the dendritic cells, and the red guys are the macrophages. So collectively, we might refer to those as histiocytes. And normally, they sit in this very ordered structure around blood vessels and interspersed between the blood vessels. And they're quite closely associated with another major type of immune cell, which is the T cell. And they're sitting there, they're keeping the tissues healthy, they're looking out for injury, they're looking out for pathogens, but they normally are very well regulated. They know when to react, but most of the time they just sit there in this kind of ordered structure. Now these guys, ultimately they all come from some kind of blood stem cell. So usually a cell in the bone marrow, a hematopoietic stem cell that gives rise to cells that go into the blood, and then these cells enter the tissues and become the histiocyte populations. So the curious thing about histiocytosis is that when a mutation arises that causes the disease, it doesn't have many cells in the bone marrow. There's probably only 1 or 2% of cells that carry this mutation. So, for example, I've shown the BRAF mutation. But it's really the cells that carry the mutation, when they get into the tissues, which is where they normally do their thing, that the cells with mutation accumulate and ultimately form a lesion that you can see when you biopsy, or that gives a problem to some function of your body. And there's this analogy, that this comes from Carl Allen, who's a pediatric oncologist, that this process is a bit like this story that was in the news a few years ago about an abandoned apartment where somebody left a tap running over the winter. So there was just a single tap in a basin in a bathroom at the top of the apartment, and it flowed out water all winter, and it turned into this giant ice fall. So that's a good way to think of the lesions that occur in histiocytosis. So there's a small trickle of cells with mutation, but they all group together and can form these lesions which can cause problems. I mean, you wouldn't be able to see out of the first floor window if this was coming down the outside. So, and very roughly, the different types of histiocytosis that we see correspond to different flavors of these histiocytes. So, for example, Erdheim-Chester disease at the top is more like the macrophages. Langerhans cells histiocytosis is more like a DC kind of cell, and maybe Rosai-Dorfman is somewhere in between. So the mutation gets into these cells, and depending on which type of cell that is affected, you get a different spectrum of disease. So is it cancer? So I think the answer to that, as Gaurav has said already, is yes, but it's a very slowly progressive type of blood cancer, and it's curious that because these are immune cells, there's a big inflammatory reaction and a big kind of healing response. So you get very strange manifestations in the body. But one of the sort of upsides is that it's a very simple genetic change that has taken place in the cells. So usually only one or a few mutations, which means that it's very responsive to treatment. So you'll all be aware of the targeted drugs that if you reverse the effect of the single mutation, you can have a good response to disease. And something that I think is a useful model is it's almost related to this other family of blood cancers that are also rare but much more known about, the myeloproliferative neoplasms. And the picture on the right just summarizes why I say that in terms of the molecules. So the left-hand side of the image shows myeloproliferative neoplasms that have mutations in genes that control the production of red blood cells and platelets, and these give rise to these characteristic MPNs. And in histiocytosis, you have mutations in the pathways that control the production of macrophages and dendritic cells, the histiocytes. And so very, very similar process underneath the hood, but the fact that the histiocytes are living in the tissue gives the diseases this weird and wonderful clinical spectrum, which we all know about. So, how long have I had it? As I said, the bone marrow probably only contains a small number of cells with mutation. So, a trained hematologist can immediately spot that Wally's here. But he might be only one in 100 cells that carry this mutation. And we can put a sort of timeline on this. This is probably measured in decades that this mutation has been there, starting to increase the burden of disease that ultimately leads to symptoms. And it's a curious feature that when this mutation is in the bone marrow cell, it doesn't give that cell any particular advantage. So it doesn't expand, doesn't take over the bone marrow. It doesn't become like a leukemia process where the bone marrow ultimately fails. So how does it do the things that it actually does in the tissue? Well, Langerhans cell histiocytosis is kind of an immune type of histiocyte, a dendritic cell. And I've drawn this kind of Ouroboros thing because in some ways this makes an abnormal cell that is similar to a cell that you see in the body when there's a cancer. So you can make cells like Langerhans cells in response to cancer. But in this case, the LCH is actually the cancer itself, so it's kind of reacting to itself, and you get this very curious accumulation of very distinctive LCH cells. And these can affect multiple sites in the body. So diabetes insipidus in the pituitary, you'll be aware of. Lots of problems with the teeth. It can get in your lungs, causing shortness of breath or dyspnea. Many of my patients have real problems with chronic pain, usually in the bony sites, but even when the scans are negative, those can endure. And then, of course, there are effects on mental function, which can be difficult to treat and easily characterized are the rashes that can be affected when cells evolve these lesions in the skin. And ECD is a bit more of a macrophage type of illness, and essentially, because you've got macrophages everywhere, you can get sites affected in many different locations, but they kind of group into a couple of sort of flavors. So the tissues where there's a lot of fat, there's always macrophages, and if those macrophages get activated, they can cause fibrosis in the fat. So those particular sites are in the bone marrow, which is where you get the bone sclerosis. Around the kidneys and behind the eye, there's a little fatty deposit that can become inflamed. And they also patrol surfaces in the body, so the lining of the skull and the brain and meninges, the lining of the lungs and the heart, and behind the abdomen, the retroperitoneum, and also the thing that lines the intestines, the omentum, and of course also actually in the brain as well. So we have some idea of how this correlates with the normal distribution of macrophages, but these are the observations. So is it going to shorten my life? Well, you probably won't live as long as Jonathan, who was born in 1832. So he's outlived all of his doctors. So you might not outlive several rounds of physicians, but hopefully with early recognition and this network of clinical teams that's evolving on both sides of the Atlantic, and of course the ECDGA and multiple treatment options, I would hope that it would not shorten your life. It's becoming a chronic illness like many other cancers. And is there anything I should or shouldn't do? Well, I usually say no to my patients. I usually say eat well, exercise as much as you can, and enjoy life as much as possible. So hopefully you won't be feeling blue, but if you have to put the blue feathers on to go to a carnival, then go for it. And that is my last slide. So any questions? Thank you.